Welcome to K-Laser Australia video series. This series of video will give you a solid knowledge about laser therapy and its application with the K-laser. What is laser therapy? For many years, laser therapy has been called various names. Low-level laser therapy is the most common one, but also light therapy, soft lasers, cold lasers, and high-intensity laser therapy. They all refer to photobiomodulation, PBM. Photobiomodulation is a recent adopted medical terminology since 2015 and is used in research and publication. The official definition of photobiomodulation is a form of light therapy that utilizes non-ionizing forms of light source, including lasers, LED, and broadband light, in the visible and infrared spectrum. Traditionally, the red light and near-infrared are the wavelengths the most commonly used. Also, the definition of photobiomodulation refers to a non-thermal process, and it is important. If some high power, usually class 4, provide heat during the treatment, it is a nice side effect, but it is not related to the true therapeutic effect of laser therapy. So the process involves endogenous chromophores eliciting photophysical and photochemical events at various biological scales. This process results in beneficial therapeutic outcome, including but not limited to the alleviation of pain or inflammation, immunomodulation, and promotion of wound healing and tissue regeneration. Which means that the photon from the wavelengths hit the chromophores in the body. Chromophores are usually metals such as iron or copper centers in proteins and enzymes in the body. The photon is absorbed by the chromophores and trigger a series of events such as the increase of ATP production, reduce acute inflammation, reduce fibrous tissue of chronic inflammation, accelerate tissue repair and cell growth, improve nerve function, blood flow, and regulate the immune system. It means that patients can benefit from laser therapy wherever there is an inflammation process and that the wavelengths can reach the tissue. Wounds were the first application with great results, but now it is also very successful in musculoskeletal application. For post-surgery or post-injury, laser therapy promotes the recovery of tendinopathy and nerve injuries, as well as it promotes pain relief of acute and chronic inflammation. Osteoarthritis is a very good example. So, how does it work? The best person to ask this question is Michael Hamblin. He wrote a first article in 2008 to explain the mechanism of low-level laser therapy. He explained it as mitochondria to be the site for the initial effect of light. It leads to increased ATP production, modulation of reactive oxygen species, ROS, and induction of transcription factors. This effect, in turn, led to increased cell proliferation and migration, modulation in level of cytokine, growth factor and inflammatory mediators, and increased tissue oxygenation. You can find the full article at the address below. A more recent publication in 2017, again available on PubMed at the following address, reviews the recent discovery about photobiomodulation mechanism. The first key point of this article confirms that photobiomodulation is due to an increase in the oxidative metabolism in the mitochondria. The main chromophore is the Cytochrom C oxidase in the mitochondria, and the photon absorption leads to increase of the ATP production, which boosts the cells, the NO or nitrogen oxide, which trigger local vasodilation, the ROS or reactive oxygen species that activate transcription factors. It says that these transcription factors can lead to increased expression of genes related to protein synthesis, cell migration and proliferation, anti-inflammatory signaling, anti-apoptic proteins, antioxidant enzyme. It also stipulates that the applications of photobiomodulation are broad. 4 clinical targets, however, are the most common: shining light on injured sites to promote healing, remodeling and/or to reduce inflammation, on nerves to induce analgesia, on lymph nodes in order to reduce edema and inflammation, and on trigger points to promote muscle relaxation and to reduce tenderness. The mechanism of laser therapy or photobiomodulation. Wavelengths emit photons that are absorbed by chromophore in the body. With laser therapy, the main chromophore is the cytochrome C oxidase, located in the mitochondria. This cytochrome is part of the respiratory chain of proteins and increases the oxidative metabolism of the mitochondria. The first effect is the increase of ATP production, which in return increases the energy of the cell and boosts its metabolism. It also increases the amount of NO, nitrogen oxide. The local dilatation in the blood vessel will then increase the blood supply. Then, the increase of ROS, reactive oxygen species, activates a series of events: the transcription factors, the expression of specific genes that will regulate the production of various proteins, such as anti-inflammatory signals and growth factors. The increase of blood supply improves tissue oxygenation and the elimination of the metabolite waste, such as lactic acid. You can expect from a better tissue oxygenation and increase of cellular ATP in muscle to be a great help in sport performance. In the same way, tissue oxygenation and cellular ATP energy create the perfect environments on wounds and musculoskeletal injury for tissue healing. In addition, the growth factors protein also accelerate the healing process. Laser therapy has also a great potential to treat painful conditions. Photobiomodulation on nerve will trigger analgesic effects. On lymph nodes, it will help to control edema and inflammation. On trigger points, it will relax muscles. Plus the anti-inflammatory signals, they all combine for a better control of pain and inflammation. Back to the article. It reminds us to consider the importance of selecting the optimum parameters for an optimal effect in the biphasic dose response. The irradiation parameters. Wavelengths in nanometers. The visible light goes from 400 to 700 nanometers. Red light is between 600 and 700 nanometers. And near-infrared wavelengths used in laser therapy are 700 to 1100 nanometers. Irradiance or power density. Watts per square centimeter, so power per area or surface. The pulse structure. The laser can be used in continu, the continuous wave mode, or on and off pulsing, the pulsing mode. The speed of the pulsing mode is measured with pulse frequency in Hertz. Coherence light versus non-coherence light. The light dose parameters. Power equal energy per time. The energy is in joule. The power in watts. Irradiation time is measured in seconds. But you need to consider the energy density too. Joule per square centimeter, amount of joule per surface. And also, of course, consider the treatment protocols, how often to repeat the laser session and how many times. All these factors influence the outcome on the patient and explain the biphasic dose response. The biphasic dose response. For each parameter, such as time of exposure, pulsing frequency, power density, energy density, treatment protocols, the response follows a curve with an optimal effect. If the parameter is too low or too high, then it is ineffective. It also means that there are many partial or minimal responses, when the parameters are close enough but not optimal. This is an example with just one parameter. Now you can imagine the difficulty to define the optimal response with multiple parameters. In addition, each tissue seems to have different optimal parameters. So, in the next chapter, we will look at the type of light source, the wavelengths, and the depth of penetration in the body. Then we will focus on the pulsing frequency, the power, the time, and how to calculate the dose. Finally, we will discuss the treatment protocols, the number and intervals of laser sessions. For those who would like to have more information, here are some reference articles.
Thank you for watching this video. For more information, you can contact us through our website k-laser.com.au.